Hi, everyone. Let's go through the questions, answers, and rationale for the second exam in our healthcare ethics class. And so let's start. First question, and before we start, I just ask you to listen to everything, even if you got the answer and the rationale correct. I think it's just going to help reinforce your process as you think about future exams. Okay, so the first question is about Cole, who has an infection commonly associated with HIV. When given the diagnosis, he refuses to be tested. How should the clinical staff react? So, you want to look at a few things. First of all, he has an intact mental status, so he's able to make decisions. But he refuses to be tested for HIV. We're not exactly sure why. That's not in the stem of the question. Question, though, is how should the clinical staff react? Now, I'm just guessing, although that's not in here, that they don't stop at just one request. It might be a couple of requests. In the end, he refuses to be tested for HIV. So, how should the clinical staff react? And we go to the ethics theme, which is the idea of informed consent. It can only be done with informed consent, but the rationale has to really be connected to the ethical issue. And you'll find that's true for the vast majority of the questions. And so this has to do with his autonomy. That has to be in here somewhere. That it could be autonomy, it could be a choice. It's not doesn't matter how you refer it. This is sort of the ethics theme, of course, or sub-theme. Um, but either way, you have to get it. It's at the end still his choice. Okay, let's go to the second question. Indiana Senate Bill 1. Under the law, who below is most likely to undergo an abortion? Obviously, in the state of Indiana. So there's just a few, three exceptions. And so you have to go to the actual Indiana Senate bill, which is on your Blackboard site. And don't try and resolve this on your own. It actually has nothing to do with age or insurance. It really is connected to a lethal fetal anomaly, which means um, that the fetus is dying, and or something is leading towards the death of the fetus, it's one of the exceptions. So that has to be in here. And simply just saying that, in the Senate bill, it specifically mentions a fetal anomaly. Fine. That's in there. Okay, so let's keep going. Um, so this was one of the cases that was in the objection of conscience case list that we discussed on September 19th. This case was one that we didn't discuss as a class. I think it's the longest one. And it's about Josh, and he's a nurse, and he's taking care of a lot of patients, and he's finding, I think he has more patients. The case is on your Blackboard site. The question is, what is the objection of conscience issue in this case, and why is it an issue? So what is it and why? You have to again go to your notes in terms of what makes an objection of conscience valid. And what you'll find is, there's my stuff here, that it if it presents a burden or an undue burden to patients, then that's a problem. And so burden is over here. It's burdening the patients or burdening the residents, or in the case of our discussion, when women are seeking either birth control or Plan B, if they are burdened by going across the street, or just like the example, driving 50 miles in a snowstorm, that is an issue. It's an issue. And so, and of course, the why is related to long hours. Now, many of you chose D, and I think D in itself, he feels consistently guilty over not providing quality care. That is a true statement. Staffing shortages are burdening. Again, a true statement. But the burden that exists for objection of conscience is not about Josh. It's about, is there a burden on the patients that he's caring for? In this case, yes. And so he is correct in consciously objecting. And so it's really thinking about burden. Now, that's actually a topic of ethics theme that will be starting soon. So we'll be exploring in different ways. But for objection of conscience is there a burden on the individual patient or resident? Okay. This is Nancy Burlington's article, Conscience Clauses, Health Providers, and how is it best summarized? It's actually really indicated quite clearly in the case that access to care takes precedence over a healthcare professional's conscientious objections. A healthcare professional has the ability to object, but not when access to care for the patient is denied. It cannot stop there. That's the issue of power. So that has to be indicated in the rationale. Let's go to number 5. And number 5 is I know that many of you during the exam were trying to understand the question because you don't have a lot here in this STEM. So some of Dr. Tim Roberts' friends say that at times this 45-year-old primary care physician does not follow his conscience when practicing medicine. Why? Well, you don't know anything about him. So it has to be, and it is in the response. How does he demonstrate that he doesn't follow his conscience? Well, there's something in one of these responses. And let's go to C. Dr. Roberts is strongly opposed to abortion. So that is a statement. His physician practice partner does provide free samples of the morning after pill, which I'm not sure how that happens, to her patients only. But it occurs within his practice. He doesn't do it, even though he's strongly opposed to it, but his practice partner does. And so you can absolutely make the case, or his friends make the case, that he's not really following his conscience. His conscience indicates that he strongly opposes abortion. So why is his partner providing free samples of this? Well, that is a conflict. And really, there's nothing else in here that is a conflict. None of the other 3 responses. So that has to be in here by association. And you have to indicate that in here. Now, it doesn't say anything about referring because Dr. Roberts is not going to refer to Dr. Orr. So that demonstrates really a conflict and therefore not following conscience. Okay, 6, we're back to the case of Andrea Anderson, who is the woman from Minnesota. And this is where a pharmacist refused to fill her Plan B medication. What might have occurred if this occurred? That's occurred twice. In Indiana today. So, I realized this when you were all taking the exam, that there's actually 2 correct answers here, A and B. They essentially are similar, very much the same. You can either choose A or B. A pharmacist in Indiana can exercise an objection of conscience, or they don't have to, and there's no penalty, which means they won't be fired or they won't lose their license. But the same is true here. A pharmacist doesn't have to fill the prescription or even refer. Now, that's actually in the House bill that many of you brought up, and you should bring up the House bill. So it's a way to really connect the rationale to the ethical issue. Let's go to the Narrative Matters article for quiz number 2. Why is the author urging physicians to defend abortion access within their communities? Now, I'll tell you this. So the correct response, right, is, first of all, she believes that it's a matter of individualized medical care. It's different for every woman here. Now, her examples are much more emergent. There's serious health consequences for not doing it. So she makes her justification. It's very individualized. Now, I will tell you this, all of the other three responses are correct statements. They are correct, but it's not answering the question. And so it's really about answering the question. Think, first of all, figuring out what the question is asking, answering the question, and focusing for the most part on the ethical theme. Okay. So let's go to 8. 8 is about the other case. This is the IVF case, which relates to the idea of selective reduction, and which is an abortion that, unfortunately, many women who are pregnant with multiples are faced with. It is exacerbated a little bit more for women or couples who are going through IVF. The question is, what is the primary ethical issue in the case? And, so the decision is to selectively reduce one or two of the fetuses, because Ashley's carrying triplets, for the benefit of surviving, or not do it at all and really take your chances at birth or even beforehand. Is there a perfect response? No. Is there even a good response? No. And so this becomes paradoxical, a paradox. Uh, a decision has to be made, but there's no good decision here. And so I think many of you actually invoke the trolley problem. Thank you very much for doing that. It connects it back to this notion of paradox. A couple of you talked about wit. Please refer back to content that we have already discussed, that you already know. It's in your notes. It's on the Blackboard site. Now, the other three, I will tell you, could be correct responses, but we're not sure. We're not sure, really, about everything. Um, what we do know is the decision that is going to be faced is really an intense conflict. And so start with what you know. Okay, last two questions. Number 9, Susan is devoutly religious, personally objects to abortion, but she's a nurse who works in the emergency department. In the past 3 years, she's assisted on 2 abortion cases, both occurring after rape. Which statement below best represents her stance? Well, it says right in the first line, she personally objects to abortion. So we know that. And so we look at this idea. She's opposed to abortion from an ethics perspective, but still supports the law. The law, as you know it, whether it be in Indiana, it's actually in every state, is that in the occurrence of a rape, a sexual assault, and the woman comes in the emergency department, it doesn't even matter if it's a faith-based hospital. Um, there can be, if warranted, a medical abortion, RU46. So that has to be then discussed over here. And many of you did that quite well. Okay, last question has to do with the Abortion Stories YouTube video. And the question is, what do the stories add to the discussion about our overall theme of ethics versus the law? And the stories were so different. And what is the key part of the abortion stories is not necessarily what happened, but it's actually the audio that you hear. And you can sense that the emotions are very unpredictable, from regret to tears to this is the best decision in my life. It's all over the place, which really makes this complex. It is not us versus them, pro versus pro life versus pro choice. It's much deeper than that if you want to go down that level. But the emotions are the key part to this. So that has to be then indicated in the response. You'll see for some of you maybe a zero point 0.5 response. And that's because to keep thinking about that as you're moving forward. Focus on the ethics theme, use the stuff in your notes, use examples from previous discussions, even past films or readings or anything like that to enhance your rationale. Okay? Thanks, everyone. Let me know if you have any questions.